Hi, everyone. My name is Selena Belisle, and I am the founder of CE Institute. And today we're going to tell you all about lymphatic drainage. More importantly, how lymphatic drainage is different than Swedish massage. Now, many times massage therapists are the ones who practice lymphatic drainage on clients who are in medical need. And that's because massage therapists are used to hands-on, light touch, manual therapies that most other medical professionals might not have the patience or the physical um, manual tactical skills to be able to apply. And massage therapists are very used to that one-on-one work environment, which makes them the ideal candidates to practice lymphatic drainage. To review the small amount of information we're going to provide you today, we're going to review the magazine article published with Massage Magazine. You can find this at massagemag.com and just search within their site lymphatic drainage Swedish massage, and you should be able to pull this article. In this article, we discuss many different things which you might find helpful to go back and review, and that includes when you're practicing Swedish massage. For any of those of you who are licensed massage therapists out there, you know that you can start just about anywhere you want in your Swedish bodywork. You can do back massage first or foot massage first or whatever the client wants. But when we're practicing lymphatic drainage, it's practiced usually in an order of sequence. And you can't really go out of that order of sequence, or else the treatment doesn't really make sense anymore. And it might not have therapeutic value if you go outside of its protocol or sequence of whether or not you're practicing on an arm or a swollen leg or something like that. So while massage can be, it's almost like an artistic talent where you can work wherever you want for as long as you want with whatever pressure you want and change the order and sequence of what you work to create that beautiful art of a massage. In lymphatic drainage, it's a pretty step-by-step protocol that needs to be adhered to have a therapeutic effect. Now, why do massage therapists practice lymphatic drainage? First of all, they have those manual, tactile, hands-on skills to be able to work quite efficiently, more so than almost any other healthcare provider. But also, what do massage therapists see? They see people in pain. So a lot of times, somebody might have a surgery that causes pain. It's ironic. We have surgery to relieve pain, but you know, immediately thereafter, you usually have more pain than what you started with. Or you might practice lymphatic drainage for other reasons, such as somebody might have an ankle sprain or strain or something to that effect. So lymphatic drainage is usually practiced to relieve swelling when people have pain from excess swelling. And in this article, what we discussed is, imagine you're a massage therapist and somebody's coming to see you because they sprained their ankle in a sporting event. Well, and they want a massage because they want to feel better. They know when they came to you after they had their back surgery or maybe their liposuction that you made them feel better. And massage therapists sometimes can magically make pain disappear, right? Well, that's certainly what we want to achieve. But imagine if you didn't have lymphatic drainage training. How do you work on somebody who comes to you with a swollen ankle and wants pain relief? If you're a regular massage therapist and practicing and you're not trained in lymphatic drainage, you wouldn't be able to work on that swollen ankle. You might be able to apply some ice, which can help relieve the swelling in that circumstance, but um, that's not really, they could apply ice at home. So why are they coming to you at a massage therapy office to relieve that swelling or relieve their pain? Well, if you have a client that comes to you, maybe they're hobbling around on crutches and now their shoulders hurt and their back hurts and of course their swollen ankle hurts, you would be able to do a full body Swedish massage, try and relieve some of that muscle tension that might have occurred from the use of crutches and hobbling around. And then when you get to the ankle, of course you can't do your Swedish massage there. When the tissue is swollen, You cannot press into a swollen tissue. Pressing into swollen tissue is likely going to stretch or tear that swollen tissue even further. So when you get to the swollen ankle, you'll do really light body work, light lymphatic drainage techniques to try and relieve some of the swelling that might be occurring in that ankle to help them feel better, to help them try to relieve pain. Now, the true practice of lymphatic drainage is sometimes called capillary work, because if you look at the lymphatic system and what we're trying to influence as massage therapists, we're trying to decrease swelling, decrease fluid in an area. And here we have some wonderful depictions of lymphatic capillaries that show the anatomical makeup. Lymphatic capillaries are made up of single overlapping endothelial cells. And if you look at the bottom left picture here of this green lymphatic capillary, you can see the purple nuclei of the single endothelial cell that's overlapping with other single endothelial cells. And that's what makes up the lymphatic capillary wall. What we're trying to do as practitioners is we are trying to take any excess interstitial fluid that's around these capillaries and get that excess interstitial fluid to absorb into the lymphatic capillary to be transported back to the cardiovascular system. Now, you might ask yourself, how do we achieve this? How do we get that excess swelling that might be in that swollen ankle or post-surgical condition or whatever was the cause to make that swelling happen? How do we get that back into the lymphatic capillary to relieve swelling? Great question. That's exactly what we're trying to achieve when we practice lymphatic drainage. When we practice lymphatic drainage, we're going to provide very light body work. In this instance here, you're seeing me just put the weight of my hand over this client who has lymphedema. And you're going to do very light body work strokes. Some of them are called stretching. We do V-flushing, we do a wave, and we do a lot of joint pumping here at the school in this training. And what we're trying to achieve is to collect that excess interstitial fluid and get it into these, in between these single overlapping endothelial cells. It's a permeable capillary wall that absorbs fluid and transport it back to the lymphatic system. And that's done through very specialized strokes that we teach in our lymphatic drainage training classes at CE Institute. So when you see people who are practicing or claiming to practice it, that they're practicing lymphatic drainage, but you can see the skin wrinkling, they're kind of bypassing the whole area absorption and collection where those capillaries are. It's estimated around 70% of our collecting capillaries that absorb that excess fluid are right underneath the skin. So anytime you're applying a lot of pressure in that on the skin, which would be similar to massage, you're kind of bypassing the whole collection process, and now you're not going to collect anything or relieve any swelling. And if you are pressing into the skin or the tissue where it is swollen, it's already stretched with the swelling. You might stretch it even further, which could cause tearing and additional swelling. So when you're practicing lymphatic drainage, one of the things that makes it different than regular massage is we're doing extremely light body work in very step 1, step 2, step 3 sequences that really cannot be altered. Also, the lymphatic drainage pathways are different than Swedish massage. When we're working in Swedish massage, we're usually practicing venous return and everything's directed towards the heart. But in lymphatic drainage, they're more sophisticated pathways. We work towards these regional lymph nodes, and those are not always directly towards the heart. Now, pressure and application. I just reviewed with you that we need to use extremely light pressure to work on those capillaries to try and encourage that interstitial fluid to penetrate and leak into the capillaries. And then we do specific movements to get that excess interstitial fluid. Once it enters the lymphatic capillary, it's called forming lymph. It's the same fluid. When you have the swelling outside in the tissues, that's called interstitial fluid. And once that excess interstitial fluid enters the lymphatic capillary, it's called lymph. Once we get that lymph in the lymphatic capillaries, then we're doing more pathway work and so forth to try and encourage it up to the regional nodes. And then that eventually makes it back to larger vessels, and they eventually all dump right here at the subclavian veins. It's also called the lymphatic terminus. Now, we're having a problem with some therapists who are applying a lot of pressure in lymphatic drainage, and it's questionable why some of the therapists are doing this. Again, if you're applying a lot of pressure, you're bypassing the initial lymphatics, and there's very little collection of excess interstitial fluid. You're not relieving any of the swelling. You need to do that capillary work to relieve the swelling and try and form lymph so that it can be eliminated by the body. Now, what's happened over the years, a lot of you are very familiar with the opioid crisis that we've had here in America for decades now, right? And a lot of clients who would be candidates for lymphatic drainage are taking opioids. That's because they've had surgery. It might be orthopedic. They might have had their hips or knees replaced. It might be cosmetic. They might have had liposuction or Brazilian butt lifts. All of this creates excessive swelling. That's the body's normal response to heal, is to swell. That's how you will heal. So unfortunately, when we have this pain, it's a good and a bad. The opioids help relieve the pain, and then the body can actually heal a little bit better and faster when you're not in excessive pain. When you're in excessive pain, your body is actually just swelling more and more and more, and it can actually create more tightness, new tissue tearing, secondary injury. In fact, there's studies that show that lymphatic drainage may help prevent secondary injury when we relieve the excess swelling. The problem is when your client's on opioids, and to relieve this pain that they might have had from their surgery or with their cancer or from a sports injury or for whatever reason cause a swelling, they might not feel that lymphatic drainage. It's very, very light body work. And here in America, we want to feel it. No pain, no gain, right? No, that's wrong. If you're causing pain in swelling, you're probably not doing anything other than further injuring the client. We need to do extremely light work, whether the client feels it or not, because we know that's what's most effective to create lymphatic drainage and relieve the swelling from that area. What's likely happened over the years with the opioid crisis is a lot of massage therapists have likely felt pressure from the clients who said, I can't feel it. I'm not getting what I paid for. I can't feel anything. So these therapists have probably been applying a little bit more pressure and a little bit more pressure to try and satisfy their clients, but they're really not doing them any service because they are likely creating more tissue damage with the additional pressure, more so than relieving the swelling, which was their entire goal to begin with. So what do you do with people who are taking opioids? We've given you two different ways to track lymphatic drainage results with clients who say they can't feel the pressure, it's too light. This is nothing like the last massage they had. Well, of course not. We're trying to relieve swelling. When you're practicing massage, we're trying to manipulate tissue, stretch tissue, create ischemic compression. The difference between massage and lymphatic drainage, again, is it's a very, very light body work to relieve excess swelling in any area. So if the client can't feel the work, how do you show them the results? Because it's usually quite minimal and they might not be able to, see it on their own body. There's two ways that we can show results with lymphatic drainage. The first way we can show results is by measuring pre and post treatment and showing them the physical numeric difference of how large their limb was prior to lymphatic drainage and how large their limb is after lymphatic drainage. We review this in our full body lymphatic drainage classes here at the school. Also, if you're doing a lymphatic facial, which we do a lot of that training here at the school, we take pre and post photos. Again, we teach you how to do this in our classes. And when you look at the photo pre-lymphatic drainage and then post-lymphatic drainage, you always see a result. And that's really fun because in addition to relieving any swelling that the client might have in our lymphatic facials, we can often diminish a little bit of the lines and wrinkles in an older client that they might have. And they love those results as well. It's usually temporary, but we do provide some reduction in edema in the area, which can help prevent secondary injury. And it might actually just kind of kickstart the lymphatic system to work more robustly once we get some of that swelling out of the area. So my name is Selena Belisle. I am the founder at CE Institute, and I am one of the instructors of lymphatic drainage here at the school. Lymphatic drainage is a huge part of our core curriculum. And if you want to learn more, specifically how to practice the light body work, to learn the different sequences and protocols, to learn what is an indication for lymphatic drainage, and more importantly, when lymphatic drainage might be contraindicated, such as if the client has infection. We don't want to increase their circulation and help spread the infection in their body. And there's many other contraindications as well. So we hope that you register with us at ceinstitute.com for any of our lymphatic classes. And until next time, be safe.